Welcome back to the River Region TV show. We're at Baptist Health here in East Montgomery. We're talking with a general surgeon here, Dr. Streetman. Dr. Streetman, thanks for joining us.
Yes, sir. Thanks for having me.
And you've seen the marketing campaign that Baptist has going across all of central Alabama, and it has to do with an issue that a lot of people deal with, and that is acid reflux. And I know you've got a lot of experience in providing people relief. What are the options these days?
Well, it starts off, we work very closely with the GI physicians, but it starts off with some dietary modifications, weight loss. There are certain medicines like Nexium, Prevacid, things like that should be tried first.
And then once patients have tried those therapies and they've either become almost immune to them from overusing them or they're not getting the results that they desire, there is a surgical option, is that right?
There is. We can correct reflux by basically tightening the valve between the esophagus and the stomach, and prevents things from being refluxed back up into the esophagus.
What are some of the major causes and why do people suffer from acid reflux?
Well, it's the basic mechanism is there the valve between the esophagus and the stomach becomes too loose, and it allows your stomach contents to reflux back up into your esophagus.
What is the surgical procedure like? How long do they have to stay here, and what are the things they have to do to get ready for that?
Well, the name of the procedure is called a Nissen fundoplication, and basically what that is we go in there and laparoscopically through 4 or 5 small holes wrap the portion of the stomach around the esophagus to tighten that valve back up. Typically patients stay in the hospital at least 24 hours. Most go home the next day. Some may stay another day or so. There are some diet modifications that go along with that wrap for a couple of weeks post-operatively, but basically patients do pretty well.
It's amazing how minimally invasive surgery is these days. You talk about doing it laparoscopically. I mean, recovery I'm sure is a lot quicker than it used to be.
It is. Typically patients are sore for a couple days, but within about a week or two they're pretty much back up to normal.
Excellent. All right. So this is a great option to consider if you're suffering from acid reflux or digestive issues. And our viewers and our listeners don't have to have a referral. They can contact you directly, correct?
Sure. We'd be glad to discuss these options with them.
We're right here on the second floor of the Taylor Medical Complex on the Baptist East campus. And what is the easiest way to contact your office, Dr. Streetman?
Well, I guess the easiest way would just be to call our office directly to set up an appointment. It's 334-244-6773.
Excellent. That information right there on your screen. We appreciate your time. Thank you.
Thank you, sir.
Good to know there are some surgical options when it comes to relief from acid reflux, and of course Baptist Health, the leading provider of world-class health care in our community. We appreciate Dr. Streetman, and we've got more on the River Region TV show straight ahead.